Uh, Hello, participants. I think we have got a good number of people joining. So we can start this webinar now. So yeah, let me start. So good morning, everyone. Welcome you all to this exclusive webinar of MEDNET mobile apps powered by MEDNET Labs. Okay, I want to start with, I have a quick question. So how many have you ever used mobile phone for healthcare recently? Maybe to book an appointment and check lab reports or even consult a doctor online. If your answer is yes, you can put your answer in the chat box. Yeah, you can put your chart. If it is yes, you have used your mobile phone in healthcare recently. Yes. Amazing, amazing. So this is exactly why we are here today. The way we interact with healthcare has changed dramatically from waiting hours in hospital queues to getting instant medical access at our fingertips. Mobile technology is revolutionizing healthcare. At MedNet, we are leading this revolution. Today, we'll explore how MedNet powerful mobile apps are transforming hospitals, doctors, and the patient experiences, making healthcare more accessible, efficient, and patient friendly. By the end of this seminar, you will see how technology can reduce hospital wait times, empower doctors, and even give patients full control over their medical journey, all from the smartphone. Before we begin, let me introduce you today a speaker. Um, I am Mohammed Shihab, leading in GCC Market at MEDNET Labs. I have extensive expertise in healthcare IT strategies and market adoption. Alongside Ms. Harsha Nakade, leading mobile apps development at MEDNET Labs, she has been instrumental in designing innovative digital health solutions that are revolutionizing healthcare access and management. Together, we will walk you through a power of MEDNET's mobile ecosystem, how it's shaping the future of healthcare. So, about today's discussion, what do you expect from today's discussion? A quick intro to MedNet and its impact on healthcare, a deep dive into MedNet's mobile apps and their role in transforming hospital operations and the patient care. I'll look at how security and compliance remain at the heart of everything we do. And finally, we will have exclusive MedNet's future roadmap and what's coming next. And along with that, we will have a Q&A at the end of this session. So you will see how mobile technology is eliminating hospital inefficiencies and improving patient experiences. So coming back to MedNet, at MedNet, we believe that healthcare should be as seamless as any other digital experience. Imagine a world where patients do not have to wait a long queues in hospital. Doctors can access real-time medical records instantly. Hospital run efficiently with automated workflows. That's what we create. Founded in 2010, MEDNET is a pioneering health tech company driving digital transformation across 300 plus hospitals in 4 continents. So our mission is simple: to connect hospitals, doctors, and the patients through cutting edge technology that enhance efficiency, security, and the patient care. We specialize in EMR, a unified digital healthcare ecosystem, ERP, enterprise resource planning, managing hospitals, LIMS, streaming lab workflows, RAS, integrating image solutions, mobile solutions, and medical device integrations, making healthcare smarter and more accessible. With compliance at our core, we ensure HIPAA, GDPR, ISO standards are met, so every healthcare interactions remain private, secure, and efficient. At MedNet, we are not just building software, we are shaping the future of healthcare. So number often tell the best story, but behind each number is a real impact on patient care and doctor efficiency and hospital operations. Let us take a closer look at how MedNet is making a difference. So we have 350 plus hospital empowered by our solution, ensuring the healthcare facilities operate smoothly with optimized digital workflows. Over 10 million plus prescriptions generated through our platform, reducing errors and ensuring faster, more accurate patient treatments. 15,000 plus hospital beds are managed, leading to improved patient flow, better resource allocation, enhanced inpatient experiences. 20,000 plus healthcare professionals are using our software application daily to streamline workflows, reduce administrative burdens, and focus more on patient care. These numbers aren't just statistics, they represent lives changed, hospitals transformed, and healthcare system that is more efficient, connected, and patient focused than ever before. So now let us get into the heart of today's discussion, that is apps for all. In the healthcare technology market, most vendors focus primarily on patient apps addressing only one side of equation. However, MedNet takes holistic approach. Our mobile ecosystem serves patient, doctors, and hospital staff, creating an interconnected, efficient system for all the stakeholders in healthcare. A truly digital hospital doesn't just enhance patient engagement, it ensures seamless staff coordination, optimized doctor workflows, improved operational efficiency. That's why MedNet's suite of app covers every touch point in healthcare. Coming to MedNet HIS 2.0 for the hospital staff and doctor, a digital command center designed to enhance operational oversight, optimize workflows, and manage hospital resources efficiently. And for doctors, a compromise you on the go solution, giving physician a real time access to the patient records, appointment scheduling, and the teleconsultation features. Coming to the MedNet Healthcare Redefined, it's a patient for the patients, a fully integrated health companion, allowing patients to book appointments, access reports, and consult doctors digitally. And for the administration, MedNet Kiosk, a self-service hospital entry point, ensuring smooth check-ins, digital consent, and reduced wait times. This integrated approach ensures that all the components of healthcare facility, from front desk operations to medical decision making function is unison. So leading to the better patient outcomes and the hospital-wide efficiency. Unlike other vendors that focus solely on patient experience, MedNet transformed the entire healthcare ecosystem, bridging gaps between the administrative functions, medical teams, and the patient interactions. So coming to the MedNet security promise, security is just healthcare is not negotiable. Patient and healthcare providers trust us with sensitive data. So it's our top priority to ensure their information is safe from breaches, cyber threats, and unauthorized access. So that's why MedNet follows strict three-layer security approach. The layer one, end-to-end encryptions, protects all the patient data in transit and at rest, preventing unauthorized access and ensuring privacy. So compliance with HIPAA, GDPR, and ISO standards adheres to globally recognized security and privacy regulations to guarantee the highest level of data precision. So multi-factor authentication, which is layer 3, ensures that only authorized users can access the system, adding an extra layer of security beyond the passwords. So with MedNet hospitals, doctors, and that their data is secure, confidential, and protected at every level. We don't just meet industry standards, we set them. So coming to today's topic, which is MedNet apps. The first is MedNet HIS 2.0. I'll just give you a brief. So MedNet H 2.0 is more than just an app. It's a digital command center for doctors and hospital staff. This mobile solution provides a real-time dashboard that gives instant insight to clinical operationals and financial performance, and attendance monitoring for human resources, ensuring efficient workforce management, workflow automations, patient tracking for better hospital efficiency, seamless outpatient and inpatient management, reducing paperwork and administrative delays. Teleconsultation integration, this allowing doctors to consult patient remotely with ease. So you can also manage ticketing internally. It manages IT support, maintenance support, and administrative support ticketing systems. So with MedNet HIS 2.0, healthcare professionals can access critical information anytime, anywhere, ensuring better decision making and improved patient care. So coming to MedNet patient app, this MedNet app is designed to put complete control of healthcare into hands of patient. It eliminates dependency on hospital visits for basic tasks and provides a seamless conventional digital experience. With this app, patient can book a teleconsultation and in-person appointments, so no more long queues or delays. You can chat directly with doctors and receive digital prescription, making communication and follow-ups effortless. And you can also access laboratory reports, radiology scans, and you can also get the case sheets instantly. No need to visit the hospitals to collect records. And you can make securely payments for medical services, a hassle-free and the cashless experience. By bridging the gap between the patients and the healthcare providers, this app ensures instant access to the medical services, enabling patient to take a charge of their health with just a few taps. So it is not just a tap, it's revolutionizing the digital patient care. Coming to the patient MEDNET kiosk application. MEDNET kiosk application, it's widely used in UAE region. It allows patients to register themselves, and you can sign the digital consent form and capture the patient attachments. And it will also allow you book appointments, follow up on appointments, and it allows you for the emergency registrations for the clinical, operational, and financial matters. This MedNet kiosk to highlight here. I could say it has helped clinics and hospitals in UAE region going from paper to paperless, and it has increased the performance of clinics and hospital by 80%. So coming next, let us move on to the real game changer, our mobile application in action. To walk you through a live demo of these apps, how it works, let me hand it over to Miss Harsha Nakade. Harsha, over to you.
Thanks, Shihab. Innovation is not about reinventing the wheel, it is about making it roll faster and smoother. On behalf of MEDNET Labs, I, Harsha Nakade, extend a warm welcome to all of you joining today's webinar on mobile applications. It is truly an honor to connect with such a diverse global audience on this remarkable platform. Earlier, Shihab walked you through a brief overview of our mobile app's powerful features. Now, let's dive deeper into each application, exploring how they can redefine efficiency, enhance user experience, and transform healthcare accessibility. Stay with us till the end as we have an exciting Q&A session lined up for you. Your insights and feedback will shape the future of innovation. Let's begin this journey together. We have three powerful healthcare apps to transform hospital operations. MedNet HS 2.0 app, which is designed for doctors, staff, and management, featuring a smart dashboard for higher management, advanced clinical tools for doctors, and HR functionalities for staff. It also includes a comprehensive support system to raise and track interdepartmental queries and operational issues, along with a dedicated platform for reporting system related concerns. Complementing this, our patient app enhances engagement with MedNet QoS app enables seamless self registration, appointment booking, and digital consent signing, creating a connected, efficient, and future ready healthcare system. Now, let's move on to our MedNet HS 2.0 app. It offers a financial dashboards which provides a comprehensive view of total revenue generated for both the hospital and pharmacy. On the top, you will see the total revenue, as well as underneath that, you will see the department wise revenue. If you want to see the total revenue, accounting to the accounting center wise, you can see the accounting center wise revenue is also displayed here. If you want to see a particular collection received on particular day, so you can check the total collection on the top, as well as underneath that you will see the payment mode wise collection. Also, if you want to see the different department collection for hospital and pharmacy, it is on the top. If you want to again drill down it on the granular narration base wise, you can see the narration wise collection is also available on that particular day. At any point of time, user can track receipt cancelled or refund initiated. Now we will move on to the discount part, where we can check the total discount on particular day on the top, as well as patient category wise discount underneath that. Same is the case with the pharmacy. Moving to our operational dashboards, We offer real-time insights into hospital workflows, including total discharges, initiated, planned, and final bill settlements. It also tracks files sent to billing, received by billing, and discharge slips printed, while providing clear visibility into open bills across OPD, IPD, casualty, and walk-in sections. Finally, our clinical dashboard delivers a real-time view of patient status, categorizing them by vitals into low, medium, and high risk. Under admissions, user can track total admissions, new admissions, planned discharge, and completed discharges. OPD monitoring offers insights into total visits, closed cases, and new patients, while casualty cases are categorized into resuscitation, emergent, and urgent cases. Together, these dashboards provide an intelligent, data driven approach to hospital management, enhancing efficiency and decision making in real time. Now, we will move to under clinical section. Our mobile app empowers doctors with essential clinical tools, ensuring seamless patient care and efficient workflow management. Doctor can easily view the scheduled patient under appointment section, where on the left hand side you will see the patient list, and on the right hand side you will see the real-time status whether the patient is confirmed, booked, cancelled, or didn't appear in the hospital. Under OPD section, you will see the patients which are confirmed under this doctor. Also, if this doctor subscribe the other doctors, we can see that list also there. Under registration section once, you will see the billing details and the registration details. Under the report section, you can view the reports. So all the reports of the different departments are available at doctor's fingertip. It becomes easy for him to give the treatment plan. Under VoiceNet section, doctor can record the notes and save it here. Under the summary section, doctor can see the OPD case sheet. Also from the bottom, he can upload the prescription. Now we will move to a telemedicine section where the patient can book a remote consultation from the patient app. If the patient's an appointment is fixed with this doctor, he can write the complaints from the patient app and same are seen by the doctor here. At any point of time, doctor can see his previous consultation records as well as the OPD case sheet. Depending on that, he will start the consultation by clicking on the video symbol. If you want to communicate through a chat box, there is a chat box available at the top. After post consultation, doctor will upload the treatment plan and the prescription over here at the bottom. He can see the previous reports as well as the attached report for the doctors. So this concludes our teleconsultation part. We will now move on to the admissions part. Under the admissions, doctor can see how many patients are currently admitted under him as well as the other doctors. On the top, it represents the total count of the currently admitted patient. That filter also can show you the discharged patients according to the selected time period. Once we click on the patient name, we can see the registration details as well as billing details here, like the category of the patient, department, and where he is located. Under investigation section, the doctor can see the reports. Also, he can raise the investigation, if any. So it gives a lot of flexibility while go. Under notes section, doctor can add the daily notes by clicking at the add notes section. Also, our app allows doctors to initiate discharge from the app. So once the discharge is finalized from the EMR section, the discharge summary would be available on our app. So with this intuitive design, real-time data access, and seamless integration, our mobile app transforms clinical workflows, enabling doctors to deliver efficient, informed, and high-quality patient care anytime, anywhere. Now we will go into our home human resource module, which offers powerful features of attendance tracking, miss punch, leave request. Also, the approver as well as requester can track the real-time status of their request. Moving on next, we'll check The attendance monitoring, where staff can check their real-time present as well as the absent entry and the leave status. Here they can easily track the weekly off, leave, late mark, and early departure. They can see the assigned shift here. Now, also they have a option of applying a missing punch if they miss any kind of a punch, like they will select the date, time, and type whether they miss in punch or out punch, write the appropriate reason and submit this request. Also, our leave request allows staff to see the leave balance, which is on the top. So according to the balance leaves, the staff can apply a leave request, select a particular period, write the reason and the emergency contact names who is taking care in his absence. Once the request is submitted, all the missed punch on leave request will be shown under pending request. So this gives a lot of flexibility for the requester as well as the approver to track the real-time status of the leave as well as approving the leaves on app. Also, once our payroll is done, employee salary slip is available on the app, directly making a payroll management smooth and accessible at employees' fingertips. Now, we will move on to our support module. Our support module ensures seamless internal communication and efficient issue resolution. With department-wise tracking, staff can raise tickets for any issue, track their progress, and ensure timely resolution. They can select the module where they are facing the issue. They will write the short description and they can attach the relevant screenshots by clicking on the camera button. With department-wise ticketing, staff can raise tickets for any issue. They can track the status of the ticket here, like whether the tickets are closed, cancelled. This module also features MEDNET support, allowing user to submit and monitor queries related to MEDNET system, ensuring smooth hospital operation. They can select the module for which they are facing a problem. They can also attach the appropriate screenshot where they're exactly facing a problem. And once the request is submitted, they can track the status of the ticket here. Also, the same tickets are available on our MEDNET client portal. So this model features MEDNET support and monitor queries related to MEDNET system, ensuring smooth and hospital operations. Every request is systematically logged, tracked, and addressed for maximum efficiency. This streamline approach enhances collaboration, reduces downtime, and keep hospital workflows running seamlessly. This concludes our MEDNET HIS 2.0 app. Now we'll go to MEDNET Healthcare Redefined app, which is particularly designed for the patient. This app redefines the patient experience with seamless digital access to healthcare services. Our app have prominent features of booking a remote consultation, also in-person visit consultation, and patient can view all their records of laboratory as well as OPD case sheet and discharge summary at one place. Now let's move on to our remote consultation feature, where our remote consultation allows patient to schedule an appointment with the doctor. He has to select a particular state and city where he want to take the consultation. He will choose a doctor of his choice and book a consultation under him. Once he chooses the type of visit, whether it is a first visit or follow-up visit, he will agree the consent and will write the reason of his complaint and make a payment. As our payment gateway are integrated with the MEDNET Healthcare Redefined app, so it becomes easy for the patient to make a payment online. And once the online payment is done, it will be seen under my remote consultation queue. Then we have another feature of booking an appointment in person in hospital. Patient can prefer the doctor of his choice and select a particular slot for which you want to book an appointment. Once the appointment is booked, the SMS will be sent to the patient and it would be seen in our My Appointment list whether it is a book cancelled by the hospital authority. He can track the status here. Then moving on next, all the lab reports of the hospitals are aggregated at one place. If this patient is visiting multiple hospital which comes under the MEDNET network, all the reports are consolidated at one place. Like this patient is visiting MEDNET Super Specialty Hospital, Vivek Hospital, and Div Care. So you will see all the hospitals reports are at one place. Similar is the case with the prescription. All the prescription and OPK sheets are available at fingertip. So does the discharge summaries. So does this app provide centralized access to investigation reports, case sheets, and discharge summaries? To further streamline healthcare management, patient can link their MRN across multiple hospital in MEDNET network, ensuring seamless continuity of care. With comprehensive report and prescription access, discharge summaries, our app empowers patients with effortless control over their medical records, making healthcare more connected, convenient, and efficient. See, this wraps our MEDNET Healthcare Redefined app. Now we will move on to self-registration app, which is also MEDNET Kiosk app. Our self-registration app streamlines patient onboarding with regular registration, casualty registration, and digital consent signing. Available in multiple languages, widely used by our UAE clients. This app enhances efficiency by eliminating paperwork for registration and medical procedures. Once we enter the hospital registration number, either we have an option of going through a regular registration or casualty registration. If we select a regular registration, patient can enter his mobile number if he is registered previously. He will receive an OTP. He will enter the OTP, and once the OTP is entered, he will see under OPD pre-registration section. He will go and edit profile, select the mandatory details. After the mandatory details are entered, he will move to the next screen where these details are not mandatory and optional. He can prefer if he want to fill in, or he can move transfer to the consent section where he can view the consent of the registration. These consents are available in his local language and completely configurable. After reading the consent, he can sign the consent, he will agree the consent. Once agreed, it is immediately available for his view. So it reduces lot of paperwork for the hospital and improve efficiency. Also, in the attachment section, if hospital wants to attach a mandatory documents, he can select the document name and take a picture. So all the documents are segregated at one place. Once he's registered, the token number will be created for his reference. Now, same patient, if is registered under the doctor for which doctor is advising him any kind of a procedure, Doctor will request a consent form from our EMR, and that same would be seen under our consent section like a registration consent. Now he will select the consent. He will read the consent. Also, this form is completely configurable. He can write a witness name. After reading the consent, he will sign the consent, accept the consent, and immediately the consent will be available for his review. Also, this app, all the signed consent will be available under this section. So this digital consent feature has proven invaluable in the UAE, significantly improving operational efficiency and compliance. Now we have another feature of booking an appointment where patient or the representative can book the appointment by selecting a preferable doctor. He will select the preferable slot and will book his appointment from the self-registration app. Our app also supports reports which are available for view purpose for patient as well as staff. So our self-registration app delivers a fast, secure and hassle-free patient experience. Moving on next, I will show you the roadmap, future roadmap, our apps. Shihab, can you please share the screen? Yeah. So journey so far uh, for all the three apps, like we have till now have 167,000 patients has downloaded the apps. There are 606,000 medical records available. We have 1.1 million reports available on our app. We have 30,000 books so far, 30,000 teleconsultation. We have booked 150K appointments over app. We have supported 7.5 thousand tickets through our IT supports. And for general support, we have 2.8 thousand tickets. So this is an amazing journey so far. Our future roadmap, like we have a home care for a geriatric as well as for the pediatric patient, which ensures seamless coordination between caregivers and healthcare provider. Like the patient can schedule home visits, they can track patient history, manage care plans. Caregiver can assign nurses, doctors, and support staff with real time. Then we have a community health app where we can real time monitor and manage the community health programs, improving outreach and preventive care. We can also enable discussion forums for support groups and experts. Also, we can organize a vaccine drive, screening camps, and health checkups. Then we have a laboratory aggregator under which we can have a facility home sample collection feature by integrating multiple lab services, which connect patient with multiple partnered labs for test booking and sample collection, where user can easily track sample pickup, processing status, and report availability. Also, there will be an real-time wearable IT device integrations, which synchronous with our real-time IT devices to track vitals like a heart rate, BP, SpO2, and temperature. Also, we can integrate, like if patients are using and monitoring the step patterns, that also we can upload through this app. And this will be automatically integrated in our EMR. So this concludes our session for apps. Now We are open for Q&A. Whoever have joined, they can either write there, open the chat box, and me and Shihab are there to answer you guys. You can raise a hand and then we can unmute you guys.
Yeah, there is two questions I see. Sorry, some technical glitch. We are not able to unmute ourselves. Yeah, but taking up this, Spasha hospitals, please show after the resolve the tickets. Asha, can you help us here on this?
Okay.
And there's
I,
one more
I think
question.
we need more clarity on this. Someone from Spurs Hospital has raised. Please show after resolved ticket. Do you want to see what happens after the ticket is resolved or what? The question is a bit hazy to answer. So can we unmute everyone? We can unmute everyone at this point actually.
Yes, yes. I think we have unmute option available for everyone now.
Yes, ma'am.
Yes.
Good afternoon, ma'am. Actually, I want to know after close the ticket, uh, the time how you know the time to resolve the how you find the report.
Yes, so I can answer this. So all the tickets are managed on MX server. I mean, the current customers of MEDNET know about MX server. All of our appointments are routed to that. So the ticketing system is also hosted on MX server. So if we need to get any kind of reports regarding the internal ticketing system, we can get it from the MX server. We can make it available in the Excel or CSV file and we can share it with you guys. And what it has is who escalated it at what time, who updated it at what time, and when resolved at what time. So all of those information is available in the Excel report that can be generated for the internal ticketing workflow.
Okay, sir. And sir, actually, when the PPT, I saw that there is a biomedical and electrical module there. Is it
Yes.
functional or
So
till it is
it's not
on?
module. It's not module. For internal ticketing, we have 5 or 6 different segments for which you can create tickets. Okay. So your ticketing can be classified into general
Yes, sir.
ticketing.
Sir, that's what I.
Mhm. Hello. Yes.
That there is a, two different module like biomedical and electrical. Something is there. Can
you
we?
go back, Shihab? So so on that point only, in that, the ticketing is classified into those segments. So when we are talking about maintenance, administrative, even biomedical, plumbing, electrical, we can have these segments created into the internal ticketing classification. So
Okay,
we don't have module of biomedical, and I think you talked
okay,
about
okay. This is
we
the
don't have
part of
module for.
the ticketing solution.
Yes, yes, yes. It is part of the ticketing solution. So we classify the tickets based on from where it was generated and where it should be routed to for the resolution.
Yes, sir. Yes, sir. Thank you, sir.
Yes. Thank you. Any more questions?
I think there is a question from Dr. Kagaukar, sir. Like in queues, there is an option to directly search for doctors, but not in the patient app. We have to can we skip the state, city, and department parameters? So this is a good suggestion. Probably we can address this in our next version in the MEDNET Healthcare Redefined app. So the patient doesn't have to select a state and a city, and preferred list of doctors will be available without that.
Yes, good suggestion. Thank you, Dr. Kalgapur. Always good suggestions only coming from your side. Thank you, sir.
Thank you so much, sir.
Any more questions on this? So to summarize it all, we have seen patient side, we have seen doctor side, we have seen staff side in this particular section of the webinar. If there are no questions, I think we can conclude the session. Mr. Rajaram, do you want to say anything?
Yeah, if there are any other suggestions, ideas, any topics also they want to cover, because we have started this as a series of webinars. As a frequency, maybe we plan to have once in a month minimum, and we could be even doing different formats. So this is like a presentation or a demonstration. We could be doing some kind of a topics panel discussion. We could be doing different formats and different topics. So if any of you, so apart from the webinar, what we did, you want to share any topics which are of your interest, which you feel more knowledge, more discussion, more debates can enhance clarity about it, please share across. Please unmute yourself and engage. And yeah, okay. But one more point has come in. Good. So likewise, Shubhankar has shared something. Uh, Many more can suggest topics going forward, formats going forward. We want to make it engaging. We want to share something. Okay, join in the process of knowledge sharing. Please share across. Bhavish, there is one point which has come in the chat. If you can check that.
Yes, so Shubhankar is asking how we can integrate the leads generated via social media into MEDNET. Is there any API integration? Shubhankar, at one or two places, we have integrated with the CRM solution. I mean, all of you know that we don't have CRM solution, and that's not our core business as well. But yes, we do have integration with one of the CRM that I know is DreamSolve. We have integration with that. So I think we can talk about the API integrations on that. Second, I mean, if you have to track it, there's a section in the patient registration where we can track the multiple sources of patient referrals coming in. So that can also be one of the possible solution for this. But yes, as an API integration, I think we have done it with DreamSolve. As of now, we are comfortable with DreamSolve. If there's something new, we can always talk about it. Shivankar. Yeah. I think there's one more question. Mehboob is asking, does internal ticket reflects in MEDNET browser version? I don't think it reflects in the MEDNET browser version. The internal ticketing is purely given for, when you are on the go into the office working and you don't have to go to the desktop to do all of this. So that's why exclusively we are, keeping it ready for the mobile version itself. But yes, like I answered the Spurge Hospital guys, we have the MIS ready for this particular thing, internal ticketing classification. So that is something that we can use for this. So that was about Mehboob's question. There's one more question by Kaustov. Uh, for OPD, how will the patients be informed about their token numbers and queue position? The patients are not tech savvy and might not be able to use MedNet patient app. So, Kaustubh, as of now, there's no tokenization available onto the MedNet mobile app or the patient app. We are not doing that. Might be a very good suggestion that any queue which is generated or any token which is generated in the patient queue management from the MedNet, we can take it into the mobile app. But as of now, we don't have that feature over here. Yeah, thanks. Thank you, Kaustubh. Thank you, Shubhankar. Any more questions, guys? We are happy to answer the questions. So for any, it might not be popping up, the questions might not be popping up readily right now. So if you guys have any questions, please get in touch with your MedNet associates, either the implementation guys or the marketing and sales guys. We are more than happy to answer your queries. We are more than happy to take your suggestions and, better all of these three apps. And like Shihab mentioned in his presentation, this is a holistic approach. We are not only focusing on the patient side, we are also focusing on the administrative side. We are also focusing on the clinical, increasing the clinical efficiency side. So that is something, is the approach for the development, and the roadmap that Ms. Harsha has shared is something that we will be incorporating in coming months and years. So I think Mansoor, Mr. Mansoor, hi, my friend. In next version, can we download the IT ticket data? Yes, sir. I know you are. Uh, uh, you're the one for which we have developed the MS. Thank you so much. Uh, Again, it's in the ready roadmap itself. Next few weeks, I can say you'll have the control to generate your IT tickets. Shout out to Mr. Mansoor from PMC Dubai. He's using the internal ticketing module, internal ticketing system very efficiently, very accurately, and these guys are doing a fantastic job. Shout out to you guys. Thank you. So I think we can conclude.
Yes, we can conclude.
Darsha, if you want to have a concluding word of thanks for everyone.
Thank you so much for
Thank
joining
you
in.
everyone for joining. If you have any additional questions or queries, this is a contact number here and this is our website. You can reach us there. If you want to see a detailed demo on this or you have any doubts, you can reach us out. We will help you sort it. Okay. I think, yeah, we can.
Yeah,
Thank you all for joining this webinar.
Thank you, everyone.
Thank you all for joining, and happy Ramadan for everyone who is celebrating.
Thank you. Thank you so much.